My name is Jihad Mustapha. I am an interventional cardiologist, and I also have a specialty in a disease called critical limb ischemia. Being in intensive care units, it just brings you that much closer to the reality of how fragile we humans can be. You know, it's so hard for me to comprehend and sort of dissect the fact that we're losing healthcare providers. It doesn't matter whether it's someone who mops the floor in a hospital or a doctor in a hospital. We're a team. All of us are a team. And yes, I am extremely emotional about this, and I'm extremely vocal and upset about it. The first friend of mine that died, that was enough for me, an ER doctor in New Jersey. And you know, what was really an eye-opener for me is how dismissive this was. No one mentioned it. It was not a big deal. No one talked about it. It wasn't on the news. It wasn't anywhere. The guy just vanished, right? It was just it. That's it. He moved him out of the way and put somebody else in his place and move on. I mean, we can't take that. We can't make that acceptable. And he's not a hero. We're not in the front line fighting, you know, insurgents and terrorists. You know, we can't justify the death of those doctors and nurses and say they're heroes. I mean, how can I not be emotionally involved and attached to this? Because, you know, I can see how they're starting to put us into this hero category. We're not fighters, we're doctors and nurses. You know, we healthcare providers. You know, please don't justify our death and prepare us, okay, if you die, you'll be a hero. You know, we don't want the recognition, we just want the support so we can save lives. And I am not in favor of calling somebody that dies a hero of something. I mean, they died because they didn't have enough protective gear. We didn't give them what they need. That's why they died. And I know that propaganda of the word hero, you actually use that word to lessen the impact of the loss of somebody. So you give them that word of their heroes. You know, they're just mistakes that somebody else made that led to their death. So it's actually, every time someone dies, I want people to think somebody screwed up, did not protect this doctor, this nurse, and they died. And they're not heroes, I call them victims.